Joint Arthrodesis. Introduction. The cartilage at the end of the bones in a joint acts as a cushion, allowing the joint to move easily and painlessly. Select true or false. Correct. The synovial fluid is a natural lubricant for joints. Select true or false. Correct. The synovium contains synovial fluid, which allows for smooth, painless motion as the bones of a joint move.
Arthritis can be slowed and controlled with various medications that decrease inflammation in the body. Select true or false. Correct.
Are heart attacks and other anesthesia-related complications common during and after this operation? Select yes or no.
Correct. Anesthesia is safe, but the older you are and the more medical problems you have, the higher the risks. Make your anesthesiologist aware of any medical problems you have had in the past.
Blood clots in the legs after an operation are harmless. Select true or false. Correct. Blood clots in the legs are very dangerous. They can cause death. Symptoms may include swelling of the leg, shortness of breath, and chest pain. Very rarely, however, a blood clot can go to the lungs and cause death without giving any other symptoms. Are infections very common after surgery? Select yes or no. Correct. Infections are very rare. Though rare, infections as well as bleeding and scarring may occur. Increased pain, failure of the bones to fuse, and nerve injury are common after joint arthrodesis. Select true or false. Correct. These risks are very rare after joint arthrodesis. Although these risks are rare, they can still happen. The operation tends to be very successful. Select true or false. Correct. The operation often is very successful. However, complications may happen.
Thank you for using Explain.